Hello friends, today we'll see how to code the arthrocentesis procedure codes and what are the CPT codes used for coding the arthrocentesis. So first we'll see the definition. So arthrocentesis is also called the joint aspiration. It's a procedure where a doctor uses a needle to take out fluid out of the joint. Joints are where the two bones meet. They allow our bodies to meet. The hip, knees, ankles, shoulders and knuckles are all joined. The joint aspiration is done when there is an extra fluid because of that extra fluid some swelling is happening in the joint. So at that time arthrocentesis will be done. But after the joint fluid is taken out, like after joint aspiration, your healthcare provider may inject some corticosteroids into the joint. So these are just to decrease the pain. These anti-inflammatory medication eases pain, swelling and stiffness. These drugs may also slow the return of excess fluid to the joint. So this after the aspiration they will inject steroids also to keep your pain under control, and then the patient should feel better. So this is actually the definition of arthrocentesis and what happens during the process of arthrocentesis. In this image you can see one joint is there where it is too much swelling because of the fluid, and after the arthrocentesis process you see the fluid is taken out and the joint may be looking at less swollen. So this is actually before and after arthrocentesis. This is happening only in joint. So these are the CPT codes based on small, intermediate joint and major joint. So each one is having two codes with and without ultrasound guidance. 2060600 for small joint without ultrasound guidance, 20605 intermediate joint with and without ultrasound guidance, 20606 with ultrasound guidance, 20610 for major joint without ultrasound guidance, and 20611 for with ultrasound for major joint. So these are the main 6 codes we'll be using for small, intermediate and a major joint with and without ultrasound code for arthrocentesis. So actually ultrasound guidance you can see here, it is included in 3 CPT codes. So mostly you will not need to use ultrasound coding guidance here, because if it is without ultrasound guidance you can use the primary code 20600, 20605, 20610. If it is with ultrasound you can code the combined code, the bundle code 20604, 06 and 11. Now here as already we have discussed, 276942 is included, so we can leave it. 77012, 77002 and 77021 will be coded as supporting CPT code if it is documented as coding guidance in the report, because sometimes with on if ultrasound is not, they have not mentioned, they will mention other coding guidance like computer CT guidance, computer tomographic guidance, fluoroscopic guidance for needle placement, or MR magnetic resonance guidance for needle placement. So you can use these 2 codes also as secondary codes with the primary arthrocentesis code. And here some points you have to remember, like for coding arthrocentesis, as you see you have to use the fluoroscopic or CT MRI guidance if it is documented along with arthrocentesis code. For aspiration and injection of ganglionic cyst for any location you have to use the 20612. For aspiration and injection of bony cyst you have to use code 20615. These are rare cases where you will get all these CPT codes to use. Then we have injection of procedure for sacroiliac joint. This is another code because we have only discussed about small, intermediate and long joint, because sacroiliac joint is having separate code, that is 27096. So these also include imaging guidance, fluoroscopy or CT, including orthography when performed. So if any steroid injection is injected with the injection procedure of sacroiliac joint, you can use code 7096, and it includes imaging guidance and it is a unilateral procedure. This is the sample report where they have coded hip arthrocentesis. For the patient has come for osteoarthritis of right hip pain, so he is having pain in hip, so they have done hip injection with fluoroscopy. So I highlighted some things where you will find it is an arthrocentesis process. So you can see dimension spinal needle was advanced with aspiration. So it's a joint aspiration they have done in hip. So aspiration, joint aspiration is also arthrocentesis. So we are taking it as arthrocentesis. This is first point to note, and then they have injected 40 mg of depomedrol, which is also a steroid. So after injection they are injecting a steroid to decrease the pain of the patient. So this will lead to arthrocentesis only. So these are the things you have. This is the way you have to check the report and the documentation where they are supporting for the code arthrocentesis. So then, since hip is a major joint, we are coding 26010. But here you can see in this report they are not using any ultrasound guidance code. So we are coding it as without ultrasound guidance, but they are using fluoroscopy. So fluoroscopy code we have added with 77002. So this is the way you have to report CPT code 26010 and the imaging guidance code as supporting code for primary procedure code. So this is the way we will code the arthrocentesis procedure. Hope you have liked the video. If you like the video, do share it and do subscribe to my channel. Thank you.